We are here to talk about a post that you made on Twitter X that a lot of people in my space got really excited about. It got passed around all over the place amongst the low carbohydrate, kind of ketogenic, carnivore type community. And
Yep.
I think it's because there's a lot of people in this community that don't really rely too much on conventional medical advice. And of course, as a dermatologist, you were probably trained on what you posted about, which I'll let you kind of tell a little bit of that backstory, maybe a little bit about your career, but it kind of set up how that post kind of came to be and how what it was like and when it went completely viral.
Yeah. So it is. So I early in my residency, I noticed that when older patients would come in, there were two very distinct groups. One, these people who were covered in sun damage and skin cancer and were robust, out living life, still at 80, doing all kinds of stuff, mowing their grass, the whole thing. And then this other group of people whose skin looked pristine and no skin cancers, no sun damage, and were sort of these frail, very almost sickly, individuals. And when I would ask about this to my attendings, they would kind of be like, "Well, it's not, I say, man, is it that the sun is like help? Like, no. It's that healthy people it's that they're healthy and that gets them out in the sun, and that's what it is." And I'm somebody who never believes kind of what I'm told. I'm always like, well, maybe that's true, maybe it's not. And so I had a strong suspicion that it was actually a reverse thing, that the sun is what was keeping people healthy and out there. And I'm somebody who thinks a lot in terms of, as humans, what did we evolve to do? Like, what was 50,000 years ago? What were humans doing? And that's probably what is best for us now. And so, right, we evolved naked outside. And so, just like the sun, that the world of dermatology literally says, the American Academy of Dermatology, there is no such thing as any safe sun. None. Any any sun you get at all, any tan, anything is a marker that you've got DNA damage and you're on your way to cancer. And I was just like, that just doesn't. We evolved naked outside. So then this study came out in roughly 2000. I think it was about 2013. Might have been a little before that, where they looked at this. It was a melanoma study, and they followed like 30,000 women for 25 years and divided them into, at the beginning, the ones who, protected themselves from the sun, and to the ones who got as much sun as they could on purpose and went to tanning beds and all that kind of stuff. And then they broke them into, lowest sun, more and more and more. And the ones who got the most sun compared to the ones who got the least sun, it was the equivalent of if the ones who were getting the least sun were all smokers. They died that much more frequently than the ones who got the most sun. And so, like, immediately I was like, son of a bitch, I always knew it. And so then I, started following it more closely. And there's this guy in the UK, got his great accent. His name's Dr. Weller. And what he has shown is that when UV hits your skin, it releases nitric oxide. And nitric oxide relaxes your blood vessels, your blood pressure goes down, it heals your endothelium. And we have incredibly strong data now that ultraviolet light is a substantial cardiovascular benefit, like substantial. So there was a study that, now the problem with all of this research is that the criticism is always, well, you don't really know it was the UV. It could just be getting outside is good for you. It's the fresh air. It's you're being more active. How do you know for sure that it's the UV? So then there was this study out of Korea. So there's a skin condition called vitiligo, where you lose the pigment in your skin. Michael Jackson might have had it. It's always controversial, but people get these like white patches on their skin. And one of the treatments is to go in these medical tanning beds. And these medical tanning beds, just very briefly, sunlight is visible light, infrared light, ultraviolet B and ultraviolet A. Normal tanning bed is ultraviolet A only, which gives you a tan but increases your risk of melanoma. We use medical tanning beds that are UVB. They don't have any skin cancer risk, but they don't get you tan as well as a UVA. But so this vitiligo, one of the treatments is for people to go in these narrowband UVB beds. they looked at people with vitiligo who got that treatment versus other treatments, and there was a 36%, sorry, dang it. There was a 36% reduction in cardiovascular events in the people who, and the only difference between the two groups was one group was getting this this ultraviolet light. There was no extra activity. It wasn't they went out, they just got more ultraviolet light. And that to me was the final nail in the coffin that, like, okay, this is now, you can continue to say, well, we don't know for sure. There have been multiple huge studies showing that people who get more sun have a lower rate of cardiovascular disease. Huge studies. We have studies showing that in dialysis patients on sunny day, because they get their blood pressure measured every time they go in for dialysis. So we have this huge database of blood pressure. On sunny days, their blood pressure is lower. And the amount that the blood pressure goes down would predict the degree of cardiovascular risk difference. We also know people get more heart attacks in the winter. The farther you live from the sun, from the equator, the more cardiovascular risk you have. So there's all of that. And I've been talking about this in the world of dermatology for years. I can't talk about it too much because my colleagues like, oh my God, like it's like I'm giving them a stroke and just not getting anywhere with it. And so I finally got to the point where I was like, so when you look at the data, the best number I can come up with is between, if people got the ideal amount of ultraviolet light, there'd be between 100,000 and 150,000 fewer cardiovascular deaths a year in the United States. The total number of skin cancer deaths, all of the skin cancer deaths, 15,000. So if staying out of the sun eliminated all skin cancer deaths, it would be nowhere near the lives that would be saved by people getting the right amount of ultraviolet light. It's really, now the takeaways, number one, don't get a sunburn, right? We didn't evolve for sunburns because in those first 50,000 years, you're outside all the time. And so people who, as it got warmer, you got more sun, your skin got used to it. And the data backs that up as well. People who work outdoors, farmers, people like that, they do not have a higher rate of dying from skin cancer, right? So people who get consistent UV, if consistent non-burning UV increase your risk of dying from skin cancer, farmers would die from skin cancer. They do not, right? So people can still make an argument like that. Well, it's not but you have to bend over backwards and twist in knots and come up with with all the different sources of all the different directions we can look at this. They all say exactly the same thing. And then the last killer one. So dermatology likes to say, avoid the sun completely, just take vitamin D supplements. So multiple things have been shown with vitamin D. A lot of autoimmune diseases are more common, people with low vitamin D. Cardiovascular disease more common in people with low vitamin D. Cancer more common in people with low vitamin D. They've been huge studies giving people vitamin D supplementation. Huge, randomized, double-blind, placebo-controlled, amazing studies that have conclusively proven vitamin D has no benefit for any of those things. The only reasonable take from all of that is that the vitamin D is purely a marker of if you're getting enough ultraviolet light. And it is just, so there's data, it's not as strong, so I don't talk about it as much, but that ultraviolet light substantially reduces your risk of rheumatoid arthritis, multiple sclerosis, dementia, depression. So lots of the diseases of the modern world, us not getting enough ultraviolet light, there's a good argument is a fundamental cause of all of that. Right now, there's other things too. It's all the chemicals we're getting exposed to. Diet is a huge part of all of the chronic disease. But when we talk about eat organic, so a carnivore diet makes a lot of sense to me. When we talk about that kind of stuff, getting as much. So I honestly believe it's get as much UV as you can without getting, and natural UV, tanning bed's not good, because it's only got the UVA part, not the rest of it. Get as much UV as you can without getting a burn. Like that is part of what I almost describe as a paleo lifestyle, is what people should be trying to do. Eat like people ate 50,000 years ago, activity like people did 50,000 years ago, sun exposure like humans were 50, like that's what we evolved for. We evolved to live like that. And it's hard. So in medicine, and now I'm straying a little bit off topic here, but I'm almost done. In medicine, we are taught, quote, evidence-based medicine. And so, as what most doctors do, when somebody says, well, what about if I try this or this diet or I try that, or what, doctors be like, nope, 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 no evidence, nope. And it's how much doctors forget. Lack of evidence is not evidence of lack. And so whenever there's stuff where, whoa, we don't have a study where 50,000 people did this and 50,000 people did that. And with sun or with diet, we're never going to get those studies because, number one, nobody can make money off of it. They're expensive to do. Number two, even if you did it and showed the difference, like has been done with sun, people would say, well, they didn't just do sun. Maybe it was just getting outside. Or with diet, maybe it was that they paid more, the being on the special diet made them pay more attention to their health in general. So we're never going to get the evidence. So it's our job to say, based on what we do know, like how the body works, what humans evolved for, does this make sense? And right, think about worst case scenario. If we tell people to do this, what's the worst thing that could happen to them? Right. So maybe we go back to, 100 years with UV. Maybe we go back to 100 years ago where there was no sunscreen and everything else. The rates of skin cancer haven't gone down over time. As we've told people, avoid the sun. Like there's no, like, on a population level downside to it. Same thing with those dietary things. What I always think with dietary stuff is, like, is it sound crazy? If it doesn't sound crazy, it may very well work. And I always think, does it sound like how people were eating 50,000 years ago? Like that, but that, how much doctors don't want to accept that things that don't have a huge study, it still might work amazingly. Like just so we shouldn't say no. We say, what I always say to my patients when they ask me stuff is, there's not, like, we don't have a study that proves that works or doesn't work, but that based on what I do know, that makes sense to me. Like I think that would work. Or based on what we do know, I doubt it. Like I don't, that doesn't make, I can't say for sure, but probably not. Like give people your best bet, your best guess, right? So, all right, that is the end of my extensive diatribe on this whole topic.
Mind blown. I love that.